we are starting with as we've already started with the general physiology. Now I'm going to take today how is there generation of the resting membrane potential and how this resting membrane potential is converted into an action potential, and we will also be looking into the ionic basis of this action potential, right? The ionic basis of this action potential. So as far as the first MBBS is concerned, let me tell you that this is a very very important topic. I mean, you get this, आपको ये full question आता है, जेनेसिस ऑफ रेस्टिंग मेम्ब्रेन पोटेंशियल, ये आपको फुल क्वेश्चन आता है. इसके अलावा व्हेन यू लुक इनटू योर नीट पीजी क्वेश्चंस, यू विल सी दैट द जनरल फिजियोलॉजी इज वेरी वेरी इंपॉर्टेंट फॉर द इमेज बेस्ड क्वेश्चंस. वेरी इंपॉर्टेंट, मतलब आता ही आता है इसमें से. So you can never move forward, and unless and until you understand the basics of this action potential, it is very difficult to understand the further topics, because everywhere the transmission of the impulses in the body is always going to be through your action potential, because you know that the body is made up of nerve fibers and we are conducting all the messages through action potential. ठीक है, तो अभी I am faculty in physiology, Dr. Reena Kaur, and let's first start with an image, or just start with a bit of brainstorming. So suppose I give you this image, ठीक है, I give you this image, and what terms describe the action potential events? That means, what is this 1 2 3 4, what is this which are telling you about the action potential? I mean, how do you come to know, or what are the different phases which will tell you about this? What are these boxes indicating? Or another way of asking the question could be, what is the ionic basis of these boxes? ऐसे भी आ सकता है. Now, the nerve action potential का duration is 2 to 3 millisecond, लेकिन the action potential of the cardiac muscle is around 200 to 300 milliseconds. So आप देखोगे कि कितना ज़्यादा difference है, and you must know that what is the reason of this difference, what accounts for the difference, right? So we will be going through the answers, but now let's start with how to proceed further. So before we move further, let's look upon into a very very important case history that is related to this topic. So there is a 6-year-old boy, okay, there is a 6-year-old boy, and this boy is brought to a family physician. देखो, always remember that the age is also very important, whether male है या female है is very important. So a 6-year-old boy is brought to a family physician after his parents notice that he has got difficulty in moving his legs and arms after playing a game. Okay, for example, यहाँ पे तो saucer game दिया हुआ है, after playing a game. About 10 minutes leaving the field, the boy becomes very weak and he is not able to stand. So what important thing we come to know? We come to know that there is a boy that who has got difficulty in playing. This is what is coming into our mind. Now after questioning, the what further we get is that the complaints also come after eating bananas. Now this is very very important. Eating banana is not important. Eating carbohydrates is important. This is telling you that it is related to something which is carbohydrate, and therefore an example of banana is given. He has got frequent muscle spasms like myotonia. There is a difficulty sometimes in releasing the grip, or there is sometimes a difficulty in opening the eyes if they are squinting in that sun. And the boy was diagnosed with hyperkalemic periodic paralysis. So it has been made easy for you. How it has been made easy is, you have been directly given like what is the diagnosis. So the diagnosis is hyperkalemic periodic paralysis. That means there is something which is related to increase in the potassium ions. Okay? There is something which is related to increase in the potassium ions, and that is associated with a paralysis. The family was advised to feed carbohydrate rich, low potassium Okay, carbohydrate rich low potassium food give him glucose during the attacks. That means when he gets such attacks, give him something which will be rich in glucose. And avoid strenuous exercise. Okay, avoid strenuous exercise. So yahan what this banana contains is not only carbohydrate but something another which is very important, which we will be looking upon. Right now, what is the effect of hyperkalemia on the cell membrane potential? Very important question that must be answered. And what is responsible for the repolarizing of the action potential? So the two important things are, that means the ionic changes like hyperkalemia or hypokalemia, they have got effect on the membrane potential, and there are different phases of action potential. So what is the cause of this repolarization phase? Right? So before we jump into the action potential, it is very important that you must know what is resting membrane potential. And to understand resting membrane potential, it is very important to know what are the different types of channels. So remember that we have covered one thing in our general physiology, that these channels are nothing but what are these channels are basically proteins. So this you must remember that these channels are nothing but these are the proteins which are integrating type of proteins. I mean integral proteins or the transmembrane proteins which are passing through and through the cell membrane. So the first very important are the voltage gated channels. Why they are called voltage gated? Because they are able to sense a change in membrane potential. Right? They are able to sense a change in the membrane potential. So whenever there is going to be any changes in the membrane potential, they are going to sense. They are voltage gated, that means they are going to open only with a change in the membrane potential. They will not open if there is binding of a ligand or by some other stimuli. They are only going to open with a change in the membrane potential. Very common, we know there are voltage gated sodium channels, there are voltage gated potassium channels, there are even voltage gated calcium channels, right? So the first type of channels are voltage gated. The next important channel are mechanically gated channels. Mechanical gated means they are kind of a stretch sensitive channel. Okay, stretch sensitive channel which are going to respond to pressure or change in the pressure or stretch. These are basically present in the smooth muscles. Okay, they are present in the smooth muscle. So whenever there is a smooth muscle, okay, that whenever the smooth muscles are subjected to stretch, there is going to be opening of the stretch sensitive channels which are usually allowing calcium ions to come under or inside. Now this point is very important because the stretch sensitive calcium channels, they come inside the cell and they cause the contraction of the smooth muscles, especially when we speak of the blood vessels. Okay, especially when we speak of the blood vessels. And what do they do? Right? Whenever there is an increase in the blood pressure, the blood flow will not be increased. Why the blood flow will not be increased? Because as there is increase in the pressure which is causing stretch, will open these calcium channels. The calciums will come inside and they will cause contraction of the smooth muscles of the blood vessels. ठीक है, वो क्या करेंगे? वो contraction cause करेंगे जो आपके smooth muscles हैं blood vessels में, and they will prevent the increase in the blood flow because they increase the resistance to blood flow. When they contract, they will cause vasoconstriction. ठीक है, जैसे ही वो contract होते हैं, what they will cause vasoconstriction. And when they cause vasoconstriction, what will happen? The resistance will increase. This is one of the theory which is related to, you know, autoregulation, that when even the blood pressure rises, the blood flow does not increase. So this is one of the theory which is related with calcium ions. So first important channels were the voltage gated channels. Second important were the mechanical gated channels. Third important are the ligand gated channels. So ligand means there is some neurotransmitter or there is a hormone which binds to the receptor site on the channel. And once this binds, okay, once this binds, what happens? The channel will open and the channel will allow ions, maybe it could be sodium, it could be potassium, it could be calcium, to come inside. A very classical example is the acetylcholine gated nicotinic channels which are present in the neuromuscular junction. Okay, acetylcholine gated matlab these are the channels which will bind or which will allow the ligand, that is acetylcholine, to bind. So जैसे acetylcholine bind होगा, these channels will open and they will allow sodium to come inside, which will help in generation of the action potential at the neuromuscular junction, right? So पहले हमने देखा voltage gated channels, mechanical gated channels, ligand gated channels, and always open. These are also called as the leaky channels. Leaky channels. What is this leaky channels? They do not require any membrane potential. ठीक है, उनको कोई membrane potential नहीं चाहिए, उनको कोई ligand नहीं चाहिए, उनको pressure नहीं चाहिए. These remain always open, right? And the maximum permeability for the leaky channels is potassium ion. And this is a very very important concept. बहुत ज़्यादा important concept है कि जो हमारे leaky channels है. Good evening Akshay, good evening. And please remain connected. If there is any problem you can also ask in between. Okay Akshay? So leaky channels. Remember leaky channels जो भी होते हैं हमारे, यहाँ पर एक selectivity पोर होता है और अ फिल्टर होता है, राइट? देयर इज अ सिलेक्टिविटी पोर और अ सिलेक्टिव पोर, और यहाँ पर एक होता है फिल्टर. नाउ व्हाई these channels are more permeable to potassium? So potassium permeability is much more as compared to sodium. Yes, it is also available on YouTube. Yes, also available on YouTube. ठीक है. Now what is the reason? You will see that the molecular size of sodium, okay, इसको अच्छे से सुनो. The molecular size of sodium is less than that of potassium, right? अगर आप molecular size देखेंगे sodium का, it is less than that of potassium. But when you look into the size of the hydrated ion of sodium, the size is more than potassium. Okay, the size of the hydrated ion of sodium is more than that of potassium. So these selective filters which are there, they will allow only sodium to pass through the channel, and they will not allow, they will allow only potassium to pass through the channel, and they do not allow sodium to pass through the channel, right? So this is a very important reason that although there are leaky channels which are present, okay, although there are leaky channels which are present, but the leaky channels has got around 100 times more permeability for potassium than for any other ion. One of the reason is that the hydrated ion size of sodium is much bigger than potassium, and it does not allow the sodium to pass through but allows only the potassium to pass through. Now this is a very important reason that why the potassium channels contribute maximum to resting membrane potential. A very important, that why the potassium ions, they contribute maximum to the resting membrane potential, right? Now Once you've understood that there are different types of channels, this is something very important, that there are different type of channelopathies. Okay, there are different type of channelopathies. What are channelopathies? These are mutations, a wide range of disease which are because of mutations in the channels, which can affect either excitable cells or non-excitable cells. Okay, so these are mutations which can affect the excitable cells or the non-excitable cells. So channelopathies means diseases which are because of the mutations affecting these channels. So this comes as a very important MCQ also. For example, periodic paralysis, mutation of potassium; myasthenia, mutation of nicotinic cholinergic or acetylcholine gated channels; myotonia, mutation of potassium channel; malignant hyperthermia, very commonly asked question, very commonly associated with mutation of ryanodine receptors, that is calcium channels; and long QT syndrome. So these are affecting the excitable cells. Apart from that, we have got channelopathies in the non-excitable cells. Non-excitable cells, for example, cystic fibrosis. Okay, non-excitable cells, for example, this is non-excitable cells. Cystic fibrosis, that is mutation of a CFTR chloride channel. Then Bartter syndrome, okay, affecting the potassium channel or the Bartine channels, which are present in the kidney, and cystic fibrosis. So these two important ones you must remember, examples of channelopathies in the non-excitable cells. Now, what is resting membrane potential of a nerve? I mean, it is responsible for which ion? Sodium, potassium, chloride, bicarbonate. So I told you that it is the potassium which is responsible for the RMP. The reason is that there are leaky channels, and these leaky channels, they show maximum permeability to potassium, right? Because they show maximum permeability to potassium, it is the potassium ion that is contributing maximum to your RMP. Now, before we go more towards the depth, it is very important that this should be nicely known to you. Even if you go through your FMG questions, or even if you go through your questions which are asked in your NEET-PG, very importantly, it is asked that what are the major ions, that is cations and anions, in the ECF and ICF, right? So you will see that in the ECF, the major cation is sodium, and the major anion is chloride. Very important question. Whereas as far as the ICF is concerned, the major cation is potassium, and the major anions are phosphates and proteins. ठीक है? So this has to be remembered. ECF में क्या क्या ज़्यादा होता है? There is chloride and sodium, and even calcium is more, and even bicarbonates. So you've got calcium and bicarbonates more in the ECF as compared to ICF. And in the ICF, you have got maximum or the most important potassium and anions in the form of phosphates and proteins. And also remember that magnesium is also more in the ICF. Another important point over here to be considered, bicarbonate is the most important buffer of the ECF. Okay, bicarbonate is the most important buffer of the ECF, and proteins are the most important buffer of the ICF. Proteins are the most important buffer of the ICF, right? Remember that when you compare your ECF and ICF, right, the selective permeability of the membrane, is the main reason that why you have got a difference in the ions in the two compartments. क्योंकि आपकी membrane selectively permeable है, ठीक है, और it allows only some ions to come inside and some ions to remain outside, और क्योंकि there is a difference in the concentration of ions in the ECF and in the ICF, that is what is responsible for our generation of resting membrane potential. और यहाँ पर हमको एक बात और याद रखना है, that ECF and ICF में there is a difference in the ion concentration, right? There is a difference in the ion concentration, but ECF and ICF, both of them will have same osmolarity. Same osmolarity. If the osmolarity changes, right? If the osmolarity changes, then what will happen? There can be a shift of the movement of water from ECF to ICF or vice versa. This will never occur normally because both of them have got same osmolarity that ranges between 280 to 290 milliosmoles per liter. Right? Now, a few very important simple one-liner. Ion which is contributing maximum to osmolarity, sodium. Ion whose equilibrium potential is closest or nearest to RMP, potassium. Ion which is most diffusible at rest, potassium. Remember the role of the leaky channels. Ion with no contribution to RMP. When we speak of single ion with no contribution to RMP, it is sodium. Ion which is associated with the regulation of the ECF volume. Okay, regulation of the ECF volume. Again, sodium. So very, very important one-liners for you. Now, what is this Nernst potential? Right? What is this Nernst potential? So remember, when we speak of genesis of resting membrane potential, you will see that the resting membrane potential is always negative. For example, skeletal muscle minus 90 millivolts, neuron minus 70 millivolts, right? Then cardiac muscle. So cardiac muscle में you have to specify ventricles minus 90 millivolts. But SA node अगर आप देखोगे minus 55 to around minus 65 millivolts. If you look into the smooth muscles, again less, minus 40 to minus 60 millivolts. That means one thing is very, very clear, that the resting membrane potential is always negative. What is the reason of this negative resting membrane potential? The reason for this negative resting membrane potential is that within the cell, matlab inside the cell, there are anions which are non-diffusible. ओके, हमारे सेल के अंदर कुछ एनायंस होते हैं, मतलब प्रोटीन्स होते हैं, which are non-diffusible. They do not move out. That is the reason that always there will be negativity inside. और वो क्योंकि कभी भी बाहर नहीं जा सकते, हमने उनको क्या बोला कि वो non-diffusible है, so वो कभी सेल के बाहर नहीं जा सकते, and therefore they are supposed to be generating the negativity within the cell. Right? Now, how do you generate a resting membrane potential? What is the cause? So when you have to write the answer in first year, or when you have to know the MCQs, the causes are first the selective permeability of the membrane. ठीक है? The selective permeability of the cell membrane that allows sodium to be more in the ECF and potassium to be more in the ICF. Then there is role of potassium ions itself. Very, very important role of potassium ions because they are also leaky. Then when you have to calculate the Nernst potential of single ion. So when you are considering the potential of a single ion, you have to calculate it with Nernst potential, which we will be learning. But since the body or we are considering the cell membrane which is permeable to multiple ions, isn't it? We have got the cell which is permeable to multiple ions, sodium, potassium, chloride. So for multiple ions we have to consider the Goldman Hodgkin Katz equation. ठीक है, we have to consider the Goldman Hodgkin Katz equation. ठीक है, अभी there is another thing which is contributing to more potassium inside and more chloride outside. That is supposed to be the Gibbs-Donnan equilibrium. Gibbs-Donnan equilibrium. Right? So when we write an LAQ in our first year, we have to elaborate these points. Selective permeability of cell membrane, leaky potassium channels, leaky channels permeable to potassium, calculation of the single ion potential using Nernst equation, multiple ions using Goldman-Hodgkin Katz equation, what is the Gibbs-Donnan equilibrium, है ना? तो ये सब हमको ध्यान में रखना पड़ेगा to solve or to even to solve MCQs and even to write the answer, right? So we will consider this now one by one so that it will be easy for you also. Now, what is this Nernst potential? So basically you must understand this first. Now suppose this is a semi-permeable membrane. Okay, sorry. This is a semi-permeable membrane which is separating two compartments, right? You see that here there are 10 positive ions, 10 negative ions, and on this side also 10 positive and 10 negative ions are there. That means both of these solutions are electrically neutral. So जब भी there are two solutions which are electrically neutral, what will happen? There is no potential. There is no potential. Right? So अगर there is an equal distribution positive negative ions का ऐसे जगह पे there is going to be no potential which is developed. अब यहाँ पर आप देखोगे कि there are again two solutions. These ions are balanced, positive negative equal है, but इनके unbalanced ions positive they are aligned across the membrane. Similarly, this side, this whole of this is electrically neutral, okay, electrically neutral, and यहाँ पर again you will see that there is aligned charges which are negative, which are not balanced. That means those ions which are not balanced will be aligned across the membrane. They will not be inside in the fluid, but they will be just lying close to the membrane. अब आप नीचे देखो third figure में, here there are 3 ions which are not balanced. यहाँ पर 1, 2, 3, 4, 5, 6 and यहाँ पर more than 6. So what does this indicate? This indicates that, okay, this indicates that the magnitude of the resting membrane potential, okay, the magnitude of the resting membrane potential will be more if the number of unbalanced ions are more. ठीक है, the magnitude of the resting membrane potential will be more, वो ज़्यादा होगा अगर number of balanced ions, unbalanced ions are more. That means the magnitude of the resting membrane potential of C is more than B, which is more than A. ठीक है, तो इसको आप ध्यान रखो कि अगर कोई membrane electrically neutral है तो there is no potential. Unbalanced ions will be aligned across the membrane and जितने ज़्यादा ions balance नहीं होंगे, magnitude of the resting membrane potential will be more. Now, what is your resting membrane potential? So resting membrane potential is also called as diffusion potential because it is contributed by the or generated by the diffusion of ions. It is supposed to be the polarized state with negativity inside and positivity outside. So this is the resting potential. That means it is the potential at rest with negativity inside and positivity outside, right? This is your RMP. Now, what is Nernst potential? What is Nernst potential? Okay, so you can, 1 minute, you can consider this more as your polarized site. Okay, more as your polarized site. इसको polarized हम ज़्यादा consider करते हैं. Nernst potential हम लोग लेंगे. It is defined as a diffusion potential, or it is a potential. Okay, it is a potential at which there is no further diffusion of ions. No further diffusion of ions. That potential at which there is no further diffusion of ions. For example, now let's understand this nicely. Okay, let's understand this nicely. Now, see, let us consider potassium for our understanding. Now, suppose this is your ICF and this is your ECF, right? And we have got leaky channels, and we have seen that the potassium concentration is more in the ICF. Now, because the potassium concentration is more in the ICF, the potassium will move outside from the ICF to the ECF. So when the potassium ion is moving from ICF to from the ICF to the ECF, due to the difference in the concentration gradient, मतलब यहाँ पर ये ज़्यादा है as compared to ECF, so it is moving down its concentration gradient. This is called as the concentration gradient. Diffusion, that is because of concentration gradient. Now, as the positive potassium ions, they move out, what happens? Inside remains negativity. Why inside remains negativity? Because we know that inside are anions which are non-diffusible. Inside there are anions which are non-diffusible, जो बाहर नहीं जा सकते हैं. और ये पॉजिटिव आयंस क्योंकि ये बाहर चले गए तो अंदर क्या हो गई है? नेगेटिविटी. अब ये पोटेशियम बाहर चला गया था, दिस विल नाउ कम इनसाइड. ओके, जो पोटेशियम बाहर चला गया था बिकॉज ऑफ कॉन्सेंट्रेशन ग्रेडियंट, इट विल नाउ कम इनसाइड टुवर्ड्स द ICF. This is called as the movement of the potassium ions due to electrical gradient. Electrical gradient. So every ion will show either a concentration gradient or electrical gradient. There will come a point where the concentration gradient will become equal to electrical gradient. There will come a point where the concentration gradient will become to electrical gradient, and that is the point where there will be no net diffusion. Okay, where there will be no net diffusion of ions. Ions will not move inside to outside or outside to inside. That is called as the Nernst potential. Okay, so every ion has got its own Nernst potential. जैसे potassium -90, chloride -70, sodium +61, calcium +132. So every ion has got its own Nernst potential, and every ion, हर कोई ion चाहता है कि उसका Nernst potential should be equal to the resting membrane potential. ठीक है, हर कोई ion wants that उनका Nernst potential should be equal to the resting membrane potential, but ऐसा हो नहीं पाता है. क्यों नहीं हो पाता है? Because सारे ions का जो diffusion rate है वो अलग अलग है, right? उनकी permeability अलग अलग है, लेकिन क्योंकि the potassium is maximum permeable at rest, उसको पूरा फ्रीडम है, अंदर से बाहर, बाहर से अंदर. ये रीजन है दैट पोटेशियम इज कंट्रीब्यूटिंग टू RMP. ठीक है, पोटेशियम इज कंट्रीब्यूटिंग टू RMP. सो रिमेंबर दिस रीजन वेरी वेरी नाइसली. नाउ let's look on to an example. How do we calculate the Nernst potential? यहाँ पर I have taken example of chloride, right? So it is given by the formula equilibrium potential for chloride is equal to RT by Fz, where R is the gas constant, T is the absolute temperature, F is the Faraday or the number of the coulombs per mole of charge, and Z is the valency of that ion that is considered, chloride, potassium, sodium, vitamin. Okay, and concentration of chloride outside and concentration of chloride inside, right? So we've taken the concentration of chloride outside by concentration of chloride inside. Now we make this entire thing very easy. What do? We convert all these constants into 61.5, right? So we replace the constants by a fixed value of 61.5, and we convert the natural log to the log base 10. We convert this natural log to the log base 10, and simply 61.5 log concentration of chloride outside by inside. So this is what is the simple formula when we have to calculate Nernst potential. If this comes in exam, always remember that take the smaller value in the numerator and the bigger value in the denominator to make the things easy, right? Now, so this is with the this Nernst potential is useful when you have to calculate the single ion potential of a single ion. Now when we consider the cell membrane, we have to consider not only a single ion, but we have to consider multiple ions, that is sodium, potassium and chloride. So Goldman-Hodgkin-Katz equation takes into account two important conditions. P, that is the permeability of the ion, and C, that is the concentration of the ion. Okay, the concentration of the ion. And what was Nernst potential taking? It was only taking the concentration. But ये क्या ले रहा है Hodgkin, Goldman-Hodgkin? ये permeability भी ले रहा है, right? So remember, because it is taking the permeability also in consideration as compared to along with concentration, and because the permeability is maximum to potassium ions, this proves that potassium is the main contributor to RMP. So the membrane potential is equal to pK, that is permeability of potassium inside by outside, plus permeability of sodium into concentration of sodium inside by outside, plus permeability of chloride and the concentration of chloride outside by inside. So these are the two positive ions, potassium and sodium. We have taken inside by outside, and because chloride is the negative ion, so just to maintain the electrical neutrality, we have reversed it as outside to inside. So you will see that when we use these two factors, that is the Nernst potential and the Goldman-Hodgkin-Katz equation, with this we calculate the resting membrane potential to around minus 86 millivolt. Minus 4 millivolt of the RMP is contributed by sodium-potassium pump. And we've learned that the sodium-potassium pump is an electrogenic pump, right? So minus 4 millivolt of the RMP is contributed by the sodium-potassium pump, right? Now let's move forward to what is this Gibbs-Donnan equilibrium. Gibbs-Donnan equilibrium gives right. Now this Gibbs-Donnan equilibrium gives us some idea when there is asymmetric distribution of ions. Then there is an a symmetric distribution of ions. Now suppose if we consider, okay, if we consider a membrane separating two compartments. This is compartment A, this is compartment B, and it has got equal number of ions. Suppose there is 5 sodium and there is 5 chloride, and on the other side also there is 5 sodium and there is 5 chloride. So you will see that both of these solutions are electrically neutral, right? Both of these solutions are electrically neutral. That means the product also of these ions are going to be same on either side. But this is not the condition with our cells, with the ICF and the ECF in our cells. This is not the condition, because inside the cell we have got non-diffusible anions that are proteins. They are anions and they are non-diffusible. That means once they are inside the cell, they cannot move out. ठीक है? अभी मान लीजिए you have got 5 potassium and 5 chloride, and you have got 2 proteins over here now. Now proteins जो हैं, they are non-diffusible. They cannot move out, right? They cannot move out. What will you do now? You have to balance, right? You have to balance these positive ions with equal number of negative ions, and 2 cannot go out. 2 हमेशा अंदर रहेगा. तो आप क्या करोगे? 3 क्लोराइड आयंस को आप बाहर कर दोगे, right? 2 chloride ions को आप बाहर करोगे. 3, that means you have to again make chloride and proteins total 5. So अगर ये 2 है तो आप इसको 3 रहने दोगे, right? और अगर ये 3 है तो आप इसको 2 कर दोगे. Mathematically proteins will always be more than chloride, right? So what is the thing is that to maintain again the balance between the positive and the negative ions, you are going to throw out the extra amount of chloride bahar. That is the reason that why the chloride concentration is more in the ECF and why the potassium concentration is more inside the cell. So even in the resting condition, chloride ions, they favor to come into the cell. They can come into the cell, but they are always going to be repelled by the presence of the anions. Okay? They are always going to be repelled by the presence of the anions in the ICF. So even if the even if these these chloride ions, they want to remain inside or they want to come back inside, they will never be allowed. They will be pushed outside or repelled outside by the negativity which is always present within the cells. So the Gibbs-Donnan equilibrium helps you to establish an equilibrium despite of asymmetry in the distribution of ions. And this is one of the important phenomenon that why the potassium concentration is more inside and the chloride concentration is more outside, right? Now let's move ahead to action potential. So remember, जब भी आपको resting membrane potential समझना है, आपको understand होना चाहिए कि why it is negative. It is because of the anions. How is the contribution of the Nernst potential? How is the contribution of the Goldman-Hodgkin-Katz equation? How is the Gibbs-Donnan favoring the potassium ions to remain inside? What is the role of the leaky potassium channels? Okay? Now, move forward to action potential. Now, what is action potential basically? So, this is the polarized state with negativity inside and positivity outside, right? Now suppose there is a cell over here, here and here, neighboring cells. So it is very easy to conduct the potential from one cell to another because the distance is very short. So this can be just done by a graded potential or a local potential. बट मान लीजिए एक सेल यहाँ पर है और दूसरा सेल यहाँ है, दैट मीन्स द ट्रैवलिंग डिस्टेंस इज वेरी वेरी लॉन्ग. In this case, the graded potentials can die off. They may not be able to complete the process. Now you require action potential. Action potential, which is self-propagatory. Which is self-propagatory. Once it is started, it is going to continue with same amplitude. It is non-decremental. It is self-propagatory, it is non-decremental, it is produced only by a threshold stimuli. Only produced by a threshold stimuli, not by a subthreshold stimuli, and it only follows the all or none law. No summation. ठीक है, there is no summation, it follows the all or none law. That means if the excitable tissue will produce a response, it will produce the response to its maximum or it will not respond at all. Once you apply a threshold or a suprathreshold stimuli, but it is never going to give you any effect by the subthreshold stimuli. Now, what is this action potential now? See, this is the action potential of a neuron. How do I come to know that this is the action potential of a neuron? How do I come to know that this is the action potential of neuron and it is not because of the cardiac muscle, or it is not because of the skeletal muscle? Now, once you consider the action potential, you have to look into 2 points. First, what is the resting membrane potential? Okay, and second, what is the shape of that potential? Right? So, it can be a spike, it can be a plateau. Right? It can be a spike, it can be a plateau. Now, if there is a spike and if it is minus 70, obviously we know it is a neuron. Right? And so if it is a neuron, it will be minus 70 and a spike. If it is a skeletal muscle, okay, skeletal muscle, it is going to be a spike and minus 90. Now, if it is a plateau and minus 90, cardiac muscle. But if it is a plateau and it is just minus 45, it can be smooth muscle. Right? It can be smooth muscle. So remember that you have to consider the shape of the spike, the shape, whether it is a spike or whether it is a plateau, and you have to look into the RMP. Even the duration is important. The neurons, their action potential is just for 1 to 2 milliseconds. They are having highest excitability, or what we call as the least chronaxy. Now, this is the neuron with an RMP of minus 90 millivolts. Okay, with an RMP of minus 90 millivolts. Now, once you give a threshold stimulus, okay, you give a threshold stimulus, this is very, very important. What is this? Rising up till this point from minus 70 to minus 45, sometimes it can be even up to minus 55. Minus 55 भी हो सकता है. This is called as threshold for excitation. Okay, this is called as threshold for excitation. This will then be converted into an upstroke which will cross the zero. So you can say this as overshoots, reaching up to a spike at plus 35, and as soon as you get a spike, there will be repolarization or the downward limb. You may also get a slight more negative RMP. This is called as after hyperpolarization. After hyperpolarization. This also you can get a slight more negative RMP. Right? Now let's look into the causes of these. Okay, let's look into the causes. Now you must understand that the action potentials are basically due to opening of the voltage gated channels, right? And there are two important channels which are considered sodium and potassium. Only if it is only when there is plateau potential. Plateau potential means there is a role of calcium, but spike potential means it is mainly sodium and potassium. Some of the important features are that the sodium channels, they are voltage gated channels, but they are very fast. They are fast to open and fast to close, and the potassium channels, they are slow to open and they remain open for a very long time, right? So they are fast to open and fast to close, that is sodium, and the potassium are slow to open and slow to close, right? Now, when you give a threshold stimulus, so you gave a threshold stimulus. What happens? As soon as you gave a threshold stimulus means you have disturbed the membrane potential, or you have disturbed the resting membrane potential. And this is actually going to result in the opening of both sodium and potassium channels. Both of them may open because there is a change in the membrane potential, and the sodium potassium, both of them are voltage gated channels. However, that potential is more favorable for sodium. It is more favorable for sodium. Moreover, the sodium are very fast to open. So meanwhile the potassium is thinking to open, मतलब potassium अभी सोच ही रहा है कि मैं खुलता हूँ, सोडियम खुलकर बंद भी हो जाते हैं. अभी पोटेशियम सोच रहा है कि I'm going to open my doors, I'm going to come out. तब तक सोडियम क्या करेगा? खुल भी जाएगा और उसके दरवाजे अभी बंद भी होने वाले होंगे. That much speed is there. So you can see that, yes, you can see, yeah, as soon as you give a threshold stimulus, as soon as you give a threshold stimulus, this is crossing of the threshold for excitation. Opening of the sodium channels is an example of positive feedback mechanism, right? Opening of the sodium channels is an example of positive feedback mechanism. What do you mean by that now? Once you give the threshold stimuli, there will be opening of few sodium channels. Okay, what will happen is there's going to be opening of few sodium channels. Say there is opening of say 10 or 15 sodium channels, and this is going to result in influx of sodium. थोड़े से सोडियम जो है वो अंदर आ जाएंगे. This small amount of sodium which will come inside will bring about positivity inside, and they will result in opening of more and more of sodium channels. ठीक है? Those small amount of sodium which enter inside will result in opening of more and more of sodium, and a drastic influx of sodium. इतना ज़्यादा sodium अंदर आ जाएगा कि it is going to result in the upstroke, which will cross the threshold for excitation, which will cross this zero and result in the spike up till plus 35. So once it comes to plus 35, this voltage will again be sensed by the sodium channels, and the sodium channels at plus 35 will close. So I repeat, you gave a threshold stimuli and it resulted in opening of the few sodium channels, and sodium came inside. These sodium ions will result in opening of more and more of the sodium channels. Sodium will rush into the cells, increase the positivity, overshoot and reach to plus 35. At plus 35, the sodium channels are very fast to close. They will close, but the potassium channels will now open. Right? Now, at plus 35, what is happening? That the positive ions, that means the sodium, are not coming inside. Okay? The positive ions, that is sodium, they are not coming inside, and at the same time the positive ion, that is potassium, is going outside. So आप क्या कर रहे हो? आप पॉजिटिव आयंस को अंदर नहीं आने दे रहे हो, और आप क्या कर रहे हो? पॉजिटिव आयंस को बाहर भेज रहे हो. That means you are reversing that positivity. Actually, what are you trying to do? You are trying to repolarize the membrane, और आप ये कोशिश कर रहे हो कि वो पॉजिटिविटी अब वापस से towards RMP आए. It should become again towards a negative side. Because if the resting membrane potential is not negative, you cannot generate the next action potential. Right? Now you will see that at some point there is, after hyperpolarization, where the resting membrane potential becomes more negative. What is the reason for this? The reason for this is that the potassium channels, they are slow to open. Okay? The potassium channels, they are slow to open and they remain open for a long time, and this results in the continued efflux of potassium ions. It results in the continued efflux of potassium ions. So positive ions, they keep on going outside, and that creates a hyperpolarization within the cell. Now this resting membrane potential will be re-established by sodium potassium pump. It will be re-established by the sodium potassium pump, and therefore the sodium potassium pump is very important, not only to establish the RMP, but once you turn off the action potential and you have to re-establish or restore the ions, then you require the sodium potassium pump, which will throw the sodium, extra sodium which was present inside, outside, and the extra amount of potassium which had moved outwards, it will get it back inside. Right? So you have got threshold for excitation, opening of the positive channels, that is sodium, which is an example of positive feedback mechanism, upstroke, that is depolarization, spike, repolarization, after hyperpolarization, and RMP. Now my question to you is, suppose you do not allow the sodium ions to close at plus 35 millivolts. What will happen? What will happen if you do not allow the sodium channels to close at plus 35? What will happen? If the sodium channels do not close at plus 35, the sodium ions will come inside till the membrane potential becomes plus 61 to plus 65 millivolts. That means the sodium ions will come inside till the membrane potential becomes equal to the Nernst potential of sodium ions. So what did I tell you? That every ion wants, हर कोई आयन चाहता है कि हमारा नर्न्स पोटेंशियल किसको इक्वल होना चाहिए? रेस्टिंग मेम्ब्रेन पोटेंशियल को. बट वो हो नहीं पाता है क्योंकि ऑल द आयंस आर नॉट एज डिफ्यूजिबल एज पोटेशियम. तो कौन सा आयन जीत पाता है? सिर्फ पोटेशियम. राइट? बट अगर आपने सोडियम चैनल्स को बंद नहीं किया तो क्या होगा? सोडियम विल कम इनसाइड जब तक उसका नर्न्स पोटेंशियल एस्टैब्लिश नहीं होगा. राइट? नाउ so don't get confused. This is action potential, this is the ionic conductance of potassium, and the ionic conductance of sodium, the broken lines, blue colored, and the permeability or the ionic conductance of potassium. So you can see that when you give the threshold stimuli, the maximum permeability is first to the sodium ions. See, maximum permeability is first to the sodium ions. So sodium ions will first, the sodium ions are first going to come inside, resulting in the entire depolarization. At plus 35, you will see that the permeability of the sodium is declining, but the permeability of the potassium is increasing. So the permeability of the potassium rises almost at the same time when the permeability of the sodium declines. And that is what is responsible for repolarization. Now, if you just want to, confirm whether you've understood or not, what is responsible for changes between B to D? So B to D is what? It is upstroke of action potential, which we called as depolarization. So it is because of the movement of the sodium into the cell. Now, what is absolute refractory period? Now, what is refractory period? So by definition, refractory period is that period where the tissue will not give response to the second stimuli. Okay, it is refractory. It is refractory means it is not going to respond to the second stimuli. This refractory period is absolute refractory period and a relative refractory period. Absolute, from the time of the firing level to the 1/3 of repolarization, and the remaining one is your relative refractory period. So you can see this is the absolute refractory period, and after 1/3 of repolarization is your relative refractory period. The difference between the two is in absolute refractory period, even if you give a suprathreshold stimulus, there is no response given by the tissue. No response given by the tissue. The excitable tissue will not give any response even if you are giving a suprathreshold stimulus. ठीक है? But relative refractory period में the tissue will respond only to a suprathreshold stimuli. Okay? Only to a suprathreshold stimuli. So, what is the reason of this absolute or what is the reason of this relative refractory period? Before that, एक बात और देखो आप. This is the nerve, and similar is the absolute refractory period in the case of the skeletal muscle. Now, if you look here, right, if you look here into the cardiac muscle, which is having a plateau phase, right, and that is responsible for the longer duration of the action potential in the cardiac muscle. Now you will see that यहाँ पर the absolute refractory period is covering whole of the systole. This is the mechanical event. Whole of the systole and 1/3 of diastole. Right? So mechanical response means the systole and diastole. पूरा का पूरा cover कर रहा है. पूरा plateau phase up till this point is your absolute refractory period. That means the cardiac muscle have got a very long absolute refractory period. What is the advantage of this? The advantage is that because it has got a very long absolute refractory period, the tissue will never respond to a second stimuli. The tissue will never respond to a second stimuli. That means you will never get ectopics normally in the heart. The heart muscle can never be tetanized. Never be tetanized. It does not show fatigue. Because even if there is a second stimulus, the second stimulus will always fall in the refractory period of the first one. पहले वाला रिफ्रैक्टरी पीरियड इतना बड़ा है कि सेकेंड स्टिमुलस इज ऑलवेज गोइंग टू फॉल इन द रिफ्रैक्टरी पीरियड ऑफ द सेकेंड ऑफ द नेक्स्ट वन. So this phenomenon, this is called as tetanization, where there is summation of contraction which can be seen in the skeletal muscle, but it can never be seen in the cardiac muscle. The reason, it has got a very long absolute refractory period. Now, what is the cause of this? It is very important that what is the cause of this. So absolute refractory period का cause है inactivation gates of sodium channel. Now let's understand this. You can see that this is the sodium channel which has got two gates, one facing towards the ECF बाहर की तरफ activation gate, और एक अंदर की साइड towards the ICF or the cytosol is the inactivation gate, right? Remember, activation gate A always active, ऐसे याद रख सकते हैं हम, but it is the inactivation gate which is much more important. ठीक है, it is the inactivation gate which is much more important and not the activation gate. Now this gate exists in three forms or three states. Resting state, that means when the membrane has got a polarized resting membrane potential -90. Activated state between -90 to +35, and inactivated state between +35 to -90. So this I mean it is showing three phases. Now, so this is your action potential. We'll consider like this. So we begin from this point where it was -90 millivolts. So all set at -90, okay, at -90, what happens? The inactivation gate is open and the activation gate is closed. But this is the state which is actually a ready state. Ready, that means जब inactivation gates जो अंदर के तरफ फेस करते हैं, जब वो ओपन होते हैं, this is the condition when the channel is ready, and as soon as you give a stimulus, as soon as you give a threshold stimulus, activation gate are already, I mean the inactivation gate are already open. बाहर का जो गेट था जो पहले बंद था ये भी खुल जाएगा, and the sodium will come inside and you will get this upstroke, activated state. Okay, you will get this upstroke, right? So first was the -90. The channel is supposed to be ready to give a response. So as soon as you give a threshold stimuli, the activated is already open and the inactive, the inside gate which we called as the inactivation gate is already open, and the outside gate will open and the sodium will come inside. Now as you reach from -90 towards +35, that is the period when the sodium channels are also going to close, right? Did not we learn that this is the period that we are going to start with repolarization? So during this phase what happens? This inside gate, the inactivation gate, it closes and this gate is still open. लेकिन अगर बाहर का गेट अभी भी खुला हुआ है, right? Even if the बाहर का gate is open, it is of no use. अगर inside gate, that means the inactivation gate is closed. So it is the inactivation gate which is facing inside that is much more important than the outside or the activation gate. So absolute refractory period में inactivation gate बंद हो जाता है. क्योंकि ये gate बंद हो जाता है, no matter whatever strength of stimulus you give, the sodium will never come inside. Relative refractory period के समय पर क्या होगा? That this inactivation gate will reset. Okay, in the relative refractory period what will happen? that this inactivation gate will reset. It will reset. That means it will be going back towards the first stage, minus 90. That means going back to the first stage where it is become ready to open. And therefore, if you give a threshold stimuli, okay, if you give a threshold stimuli, you will get a response. So it is the sodium gates and especially the inactivation gate of the sodium which is much more important. The potassium gates are very simple, existing only in two forms: resting, where the gate is closed, and slow activation, where the gate is open. It has got only one gate facing inside. Now, the action potential of the neuron is 1 to 3 milliseconds, skeletal muscle 2 to 4, smooth muscle 10 to 50, but that of the cardiac muscle is 200 to 400 because of the very long absolute refractory period. But more important, it is due to the plateau phase, which is a very important feature. And when we will start our cardiac physiology, you will come to know that plateau phase में जो calcium आता है, okay, plateau phase में जो calcium आता है, that is very important, not only for the plateau phase but also for the contraction. We will say this difference, that what is the role of calcium, ECF calcium or ICF calcium in muscle contraction, both in the skeletal muscle and in the cardiac muscle. Now, remember what question we studied. I showed you a history where we started with hyperkalemic periodic paralysis and what is the effect of hyperkalemia on membrane potential. So hyperkalemia on the membrane potential causes depolarization. What is this now? See, now suppose there is, we consider both ions. Now suppose there is sodium and you increase the sodium concentration. What will happen? There is no effect on RMP. There is no effect on RMP because sodium has got no role in RMP. However, the magnitude of action potential, can increase with sodium. The magnitude of action potential will increase with sodium. Now, what is the role of hypo and hyperkalemia? This is very important. So, what is the role of hyperkalemia? Now, suppose there is hyperkalemia, that means increase in the potassium concentration outside. Okay, अगर ECF में potassium concentration आपने बढ़ा दिया, there is hyperkalemia. Now you know that already inside there is lot of potassium and we have got RMP minus 90 millivolts. Now if the potassium is already more outside, that means if there is hyperkalemia, what will happen if there is hyperkalemia? This potassium will not go outside. जरूरत ही नहीं है ना, there is no concentration gradient, तो वो जाएगा ही नहीं. तो क्या हो जाएगा? This potassium will remain inside and will create positivity. That means the resting membrane potential will become more positive and therefore the depolarization becomes easy. Okay, and therefore we say that hyperkalemia results in depolarization. Okay, hyperkalemia results in depolarization, a faster depolarization, because the resting membrane potential is not so negative. There is increased positivity inside. On the contrary, if there is hypokalemia, what will happen? The potassium which is here inside will keep on moving outside due to concentration gradient and create a lots of negativity inside the cell, or the inside of the cell will become hyperpolarized. Okay, the inside of the cell will become hyperpolarized. the resting membrane potential will become more negative, and therefore the tissue will become less excitable, right? So hypokalemia, hyperkalemia, and one important is calcium. What is the role of calcium? Now we know that calcium is needed for muscle contraction, right? Calcium is needed for muscle contraction, but with hypocalcemic, like suppose in hypoparathyroidism, there is hypocalcemic tetany, and you get carpopedal spasm, you get the chopstick sign, ये सब मिलता है. What is the reason? When the calcium level goes down, the membrane becomes more excitable, unstable, more excitable. And even if there is a very small change in membrane potential, even if there is a small insignificant change in the membrane potential, there will be a spasm or a small muscle contraction or a twitch. The reason is that under normal conditions, this calcium is known to guard the sodium channels. Calcium guards the sodium channels. That means it does not allow the sodium ions to open abruptly. It will allow the sodium channels to open only at a very particular voltage. लेकिन अगर calcium कम है and the guarding of the sodium is lost, what will happen? The sodium ions, the sodium channels will open at any potential. If there is a slight insignificant change in the membrane potential, they will open, right? वो खुल जाएंगे. So that is the reason that why the hypocalcemia results in muscle twitches. Okay, that is the reason that why hypocalcemia results in muscle twitches. ठीक है. Now, yes. So hyperkalemic periodic paralysis में क्या होता है? There is a mutation in the subunit of the skeletal muscle sodium channel, right? And these attacks, they are triggered by exercise, stress, fasting, or if there is ingestion of large amount of potassium. For example, bananas. Bananas are known to be very rich in potassium. Now, what is the mechanism in hyperkalemic periodic paralysis? That there is a mutation in the alpha subunit of the sodium channel that does not allow the sodium channel to close effectively. You know that it is very important for the sodium channels to close. If they do not close, what will happen? If they do not close, there will be a persistent inward current. If they do not close properly, there will be a persistent inward current which will keep on depolarizing the muscle membrane, producing hyper excitability and muscle twitches even under resting condition, right? So even though it is called as a hyperkalemic periodic paralysis, but there is supposed to be a mutation in the sodium channel. And with depolarization, what will happen? The ECF level, potassium will get elevated, the sodium channels will get inactivated, and once the sodium channels remain inactivated, they will remain inactivated until repolarization. So this inactivation blocks the action potential. You know, it is very important that the sodium channels, the inactivation gates, they should go back to their resting condition. If they do not go back to their resting condition, you cannot develop the next action potential. So probably you are going to result in muscle weakness. What is the role of a carbohydrate diet? A carbohydrate diet, like you ask the patient to take glucose, this carbohydrate diet will increase insulin. Insulin promotes the uptake of potassium ions into the cell. Okay? It promotes the uptake of potassium ions into the cell. And this person is used, avoided with exercises, because exercises, they release the potassium outside into the ECF. So you have to keep a low potassium levels, right? Now, so this is all with today's topic, and we again just go back, to the first slide. Okay, we just go back to the first slide where I had shown you one image, and I started with that image. Yeah, I started with that image. What terms or what these boxes are showing? So again, what boxes are showing? All that we covered: the threshold potential, the upstroke, the overshoot, the downstroke, and the after potential or the after hyperpolarization. Remember, the nerve action potential is dominated by the inward sodium current, which activates and then inactivates within 2 to 3 milliseconds. The upstroke in the off action potential in the heart myocytes is not only driven by inward sodium current, but there is action potential which is showing the plateau phase, which is also favored by the inward calcium current. This calcium current or that plateau phase is responsible for the prolonged duration of action potential in the cardiac muscle. Okay? So this is very, very important. Again, what is resting membrane potential? Then look into the action potential. What is the shape? What is the RMP? Then it is a true action potential will follow all or none law. It will never show summation. It can be elicited only by a threshold or a supra-threshold stimuli. It is very important when you have to, take the impulses to a long distance. For example, if you consider the optic pathway has got cells, and the potentials, they travel from one cell to another only through the graded potentials. But only the ganglion cells and the axons of the ganglion cells, they are going to form the optic pathway. These show true action potential. So when you have to take it to a longer distance, then you require the action potentials, right? So this topic per se is very, very important. As you see, case-based history comes from here, image-based question comes here, from here, and first prof may LAQ come from here, right? So this is all for this lecture. Next we start with the neuromuscular junction and the muscle contraction. Happy learning, boys and girls, and good night. If you have any queries, you can put over here. I'll try to answer in the next session. Thank you.